Nations Development Program, Ms. Beavers led many global and regional initiatives to advance human rights, gender equality, and women's empowerment, including in the context of HIV and the rights and inclusion of lesbian, gay, bisexual, transgender, and intersex people. During her career, Ms. Beavers has lived and worked in Fiji, Papua New Guinea, the United States of America, and her home country, Canada, and has supported many governments and civil society in a range of development contexts. She holds a Master's of Laws degree in Common Law with an International Human Rights specialization. We are honored to have you with us today, Suki, bringing your wealth of experience, expertise, and knowledge to our side event on this very important topic.
Thanks very much, Ruby. I'm really thrilled to be here with you and Josephine and Marie and with all of the participants, and I'm looking forward to learning from all of you today. Thanks.
Thank you so much. We also have Josephine Achieng. Josephine Achieng is a feminist activist with special interests in centering sex workers and harm reduction programs. With a lived experience of drug use and sex work, Josephine is committed to creating real space and resources for the unmet needs of sex workers who use drugs. Currently, she is the Deputy Director of Bar Hostess Empowerment and Support Program, a sex worker-led organization in Kenya, and a strategic advisory board member of the Women and Harm Reduction International Network. She has also been active in designing and implementing various campaigns to end the war on drugs and advocating for the gender-responsive harm reduction services. Thank you so much for being here and part of this important panel, and we appreciate you bringing your expertise and experience today.
Thank you so much, Ruby.
Great.
I'm happy to be part of this.
Thank you so much, Josephine. And then we have Marie Schneider. Marie was a member of the Young Sex Workers Who Use Drugs working group that created the narrative research paper that this side event was themed around. She is currently studying gender studies in Berlin and identifies as a young sex worker who uses drugs. Thank you so much for being here, Marie. We are very excited to have you as part of this event and also bring in your knowledge and experience.
Thank you so much. I'm very excited and grateful for this event and to be able to take part in the discussion and the dialogue. Thank you.
Fantastic. So that brings us now to a little bit of a rundown of the findings and the content of our narrative research paper that we produced last year that both Josephine and Marie were part of creating. So Carolina, if you can share the slides. Perfect. So next slide. This is the beautiful graphic that we had done by a graphic designer for our site for our research paper. So if you've seen these hanging around the Vic over the past few days, yes, it would be great if you could take a read. And there's a link on our website, of course, to read it as well. So first of all, just a brief introduction of UthRISE. Next slide. UthRISE works with young people who use drugs all over the world through our international working group and management team, consisting of young people who use drugs and young people working for drug policy reform and youth-friendly harm reduction services. Next slide. We advocate for full spectrum harm reduction, which includes all of the people who use drugs and all the methods with which they use them, all of the political, social, and environmental context surrounding this. And we hope to further reduce stigma, discrimination, and inhumane situations that people who use drugs in all of our diversity and intersecting identities find ourselves in. Next slide. So we created this research, narrative research paper last year. We put together a group of, I think it was seven people working in the field of drug use and sex work, those identifying as young sex workers who use drugs. And we came together to create this research paper. These people were based across Africa, Central and Eastern Europe and Central Asia. And the paper seeks to call attention to the specific needs of young sex workers who use drugs and young sex workers and the necessity for tailored and gender responsive harm reduction services. It presents evidence and narratives from young sex workers who use drugs and clients regarding the core issues they commonly face, discrimination and stigma, and various risks that put their physical and mental health at risk, and so their integrity. This paper also acknowledges the importance of sex work and sets out recommendations related to young sex workers who use drugs. Next slide. Just a few notes on the limits and considerations of this paper. It is a narrative research paper. It's not a research paper that you would find in, say, a journal, but it is based on it's defined as collecting and analyzing the accounts that people tell to describe experiences and offer interpretation, also mixed in with the limited amount of data that there is on young sex workers who use drugs to create the paper. And really, I think the paper does highlight the need for a lot more research on this population and the intersecting identities. Next slide, please. So the first part focuses on discrimination and stigma. A person who exercises sex work, uses drugs, and is young often suffers from a triple compounded stigma and double criminalization. This means that harm, discrimination, and social exclusion and marginalization are even higher. Said stigmatization and criminalization do not depict the complexity of the experiences of young sex workers. Rather, they dehumanize and devalue them. The reasons for starting sex work are plenty, and they strongly relate to young sex workers' personal context. Some are linked to means of livelihood and support of dependent relatives, and others are related as a source of emancipation, autonomy, and empowerment. Next slide. Evidence has shown that stigma, which can manifest in a variety of forms, for example, condescending attitudes and mistreatment, refusal to take young sex workers' needs seriously, and trying to convince young sex workers to quit sex work without an understanding of the complexities of their individual sex work experiences. This stigma, or expected stigma, by young sex workers who use drugs, pushes young sex workers who use drugs into clandestine environments, which by their nature are riskier in health, economic inequality, and violence, and represent one of the most reported barriers to accessing healthcare. Other barriers are concerns related to anonymity or confidentiality, and a belief that healthcare facilitators are uninformed or underinformed about sex work. Next slide, please. This is a quote from one of the working group members. We got quotes throughout the document, so I again recommend you read through. This person has said, both any drug use and sex work are illegal and heavily stigmatized in my country, so I need to be extra careful about what I do and who my clients are. Firstly, I keep my sex work secret to the larger society, which creates isolation and makes it harder to connect with other sex workers. Secondly, I do not use drugs in my work at the moment, but I use them recreationally, and I keep that secret from my clients for many reasons. They can easily use it against me and report me to the police, who would also treat me even worse. They might stigmatize drug users and become violent, or I may lose work, etc. Such secrets, lack of safety and stability certainly don't help my mental health. Next slide. So a little bit about the risks associated with being a young sex worker and young person who uses drugs. And again, our panelists will delve into this a little bit more. But evidence has shown that STIs and HIV prevalence among sex workers varies significantly depending on the country and sub-region of the world, but also in the intersections that cross this population, such as age, gender, and drug use habits. A common practice in some contexts, for example, Central Europe, is chemsex, which involves drug use during the sexual encounter and commonly includes polydrug use, the use of 2 or more drugs during the consumption session. Said practice involves its own risks, such as overdose, the vagueness of consent, and the notion of choice of using drugs during the sexual encounter, which can result in physical harm and financial exploitation. In studies across India, Nepal, Thailand, and Canada, young age in the sex work environment represents a higher vulnerability to physical and sexual violence, victimization, and relates to a 2 to 4-fold increase in HIV infection. As a young sex worker who uses drugs, people are also taking the risk to be more persecuted by the state, particularly by law enforcement agents, such as police officers, military, agents from the prison system, etc. On this matter, stigma represents a factor that has pervaded the legal system and law enforcement agents. One of the consequences of this is unreported crimes by young sex workers who use drugs, and even less reported crimes from young sex workers who use drugs. When this key population is crossed by an intersection, such as being a migrant or belonging to the LGBTQI community, the mistrust of the legal system is greater. Violence is also perpetrated by law enforcement agents, such as the police. Particularly young sex workers and young sex workers who use drugs experience very high levels of violence from the state's authorities, for example, harassing or having coercive sexual activity with young sex workers, bribing them, taking their condoms away, raiding their workplace, etc. The lack of access to justice for young sex workers and young sex workers who use drugs represents another form of violence inflicted by their own state. And adding further intersections such as migrant and/or indigenous backgrounds or binary non-conforming identities adds to the already debilitating barriers to the justice of doing sex work. The high levels of violence that sex workers and young sex workers who use drugs commonly face has an impact on their physical and mental health. Next slide, please. But sex work is not just about risks. Sex work is work, which means it provides young people with a livelihood. It is work that can fit around other commitments easier, including caring for a child, studying, living with a disability, health issues, etc. And the pay can be greater than other jobs. And in certain contexts, this makes the most sense for people. In more precarious settings, steady income from sex work can be an essential and first point of escape and empowerment, especially those from unreliable or abusive family backgrounds, from LGBTQI+ communities, but also migrant and illegal or undocumented workers. And that brings us to the end. Next slide. If you have any questions, feel free to contact me. That's my email. And if you want to check out our resource, that's our website, and you can check out the resources page, and it's right there for you to read. Thank you so much. I'm now going to bring you to the questions. So our first question is directed to Josephine. And I was wondering about what are the challenges that young sex workers who use drugs face in your country and region?
Thank you so much, Ruby, for the question, and everyone online and physically present here. We really appreciate, waking up at 8 a.m. and coming. Before I give my submission, I would really like to take this opportunity to really thank UNAIDS for the meaningful engagement of young people and also promoting the Young Sex Workers Who Use Drugs project. I think I've been here for the whole week in the CND, and I've been attending all these side events, and there's no single event that was really shedding a lot of lights on key population. So I really feel like that is a really good thing. And it's been a great process, linking policy to the lived experiences to the working group that produced the research that Ruby just talked about, and also just to thank the Women and Harm Reduction International Network for the great mentorship and also for the support and inputs that they give through the Strategic Advisory Board to come up with this paper. So I would really say that globally, engaging young people who use drugs from key populations, including people who inject drugs, women who use drugs, people living with HIV, transgender people, and people who identify as LGBTQI+ persons, is fundamental to harm reduction. Despite the increasing support for engaging people who use drugs in all their diversities, I still feel there is limited evidence and focus on the engagement of young people and especially young sex workers who use drugs in harm reduction interventions. So many young sex workers who use drugs experience double stigma and discrimination, and you can really get this through the criminalized nature of both drug use and sex work, and so many other barriers to accessing health and harm reduction services due to their age. There's the issues around the age of consent, and really some countries actually have policies and procedures in place that would really be limiting someone to really access services, identifying as a young sex worker and also identify as a young sex workers with a young age. So experiences in age restriction when trying to access basic healthcare services such as HIV testing or counseling. And also there's the issue of, the healthcare workers, the structural barriers for healthcare workers who are actually sometimes very reluctant to provide services, particularly to young people, and especially services around the opioid substitution treatment and other medication therapies. So this really leads, sorry, this really leads to both self and community inflicted stigma. And when we talk about issues around barriers to access of services, I really look at it as a multisectoral levels of stigma and discrimination that really would not make someone want to access services. And probably this would really have very bad, poor health outcomes for the young sex workers who use drugs and who are also trying to access services. So there's also an issue around poor lack of strategies to ensure access to quality SRHR information and services. And this has also been a huge challenge for the sex workers. So in the Kenyan context, there's an issue around proximity and access to service delivery, where you find that there are these community-led clinics, and there's probably not, there's no one-stop shop for a young person and a sex worker who's using drugs at the same time. So that really creates a lot of systematic barriers and really leaves you at the middle and trying to wonder exactly how else would you access these services. So I'd really just say, like, overall, sex workers faced a lot of stigma in many regions, which really results to some of the harmful practices and access to services barriers. Thank you.
Thank you so much, Josephine, for providing some of your expertise and knowledge, especially in the context of Kenya. So my second question is posed to Marie. So how is the political and legal climate for young sex workers who use drugs in your country and region?
Thank you. I'll also take this moment just to quickly thank YouthRISE for opening this platform for us. It feels super good to sit here and talk about my own experiences, be part of the process of research, and also presenting it. That's amazing. Like Josephine, I also took part in in many side events over the course of this week. And what I haven't really seen was intersectional approaches to policy reform or research. And that's what I really appreciate in YouthRISE, because they really push for not just amplifying youth's voice, but also considering that youth is super diverse and that we need to consider many different parts of youth's identity. Yes, but let me get back to the question. So of course, Kenya and Germany are very different in their legal, very different in how the legal system treats sex workers and drug users. Nonetheless, there are quite some similarities, and when we were talking about stigma, we can definitely relate. Just to give a quick overview of the legal situation that sex workers face in Germany, similar to the way that drugs and drug use are regulated, sex work is often on a national level either also criminalized, decriminalized, or legalized. Germany legalized sex work in 2002 and issued the Prostitution Protection Act in 2017, which regulated sex work further. Some of the key provisions of this law are that registration as a sex worker is mandatory. Brothel operators are now required to provide certain health and safety measures like condoms or testing, and there's an age restriction. The policymakers stated that the law intended to improve the working conditions of sex workers and combat human trafficking by adding these regulations. This might sound good at first, however, almost all sex worker-led organizations spoke out against the law. And there's several very valid reasons for this. And they intersect and reflect the concerns and challenges of not involving young people who use drugs. First of all, neither the drafting nor discussions around the law or the final ruling for the law involved the input of sex worker-led organizations. Already during the drafting of the law, many organizations disclosed their concern that it in fact would worsen working conditions for sex workers across Germany. Regarding the law, we are most vocal about the pressure to register as a sex worker. First of all, because sex work, despite its legal status in Germany, is still very stigmatized as a profession, like drug use too. And second of all, it makes it impossible for migrants, for example, and other marginalized groups who for many reasons might not be registered in their place to comply with the law, and they thereby risk large fines and worse. This law therefore pushes the most marginalized even further into the margins. Long story short, what this example shows very well is that laws will never match the actual needs of those affected by them if those people are not involved in policymaking, something that people who use drugs demand constantly. What we need is more community involvement, and that already starts with identifying the issues and continues with consulting lawmakers, providing feedback on policy proposals, and the overall decision-making and implementation process of all laws that criminalize and stigmatize young sex workers who use drugs. What we need and what YouthRISE calls for, as I already mentioned, is an intersectional and feminist approach to research and policymaking for these groups of people. But back to the question of what is the legal and political climate in Germany. Of course, these administrative and structural circumstances have an impact not only on young sex workers who use drugs directly, but also on the attitudes of the general population. Like Josephine has already talked about, stigma and discrimination are inevitably linked. Stigma in many cases leads to discrimination and often violence. And in this context, particularly sex workers who belong to a younger age group are often overlooked and not taken seriously. The underrepresentation that I was talking about earlier is even more so true for young sex workers. The stigma on drug use only further deteriorates young sex workers' standing in society and puts up additional barriers to access appropriate safety and health services. Prohibition and prohibitory laws, whether it is drug policy or sex work, consolidate stigma around these topics. With youth frameworks, the UNODC is already making an effort to include youth further, but without explicitly including young sex workers who use drugs, people like myself will be left behind. We at YouthRISE therefore call for more involvement, not only of youth, but providing spaces for groups within this very diverse group of people to speak up and participate. I've already talked quite a bit about the legal situation in Germany. Almost done, but it is in fact quite a crucial time for sex work policy in Germany. That's why I'm emphasizing this so much. The Prostitution Protection Act, which was adopted in 2017, was reviewed in the last year over the course of 2022. And a final decision will be taken in 2025 on what is to happen to the law. With a push for more conservative politics in many parts of the country, voices demanding the criminalization of sex work in Germany have gotten louder. This so-called Nordic model would mean that the selling of sexual service would still be allowed and legal. However, clients would be persecuted for buying sex. Many sex workers have spoken out against it, as criminalizing, even if it's just partly, would push sex work into the underground and make particularly young sex workers more vulnerable. Partial criminalization with the introduction of the Nordic model would most certainly have negative effects on sex workers in Germany. This is an opinion that is already out there, and it is rooted in lived experience. So for the audience, not just governments, we can all speak up for the decriminalization of sex work and drug use and against the Nordic model. Thank you.
Thank you so much, Marie, for sharing. Yeah, it was very insightful. My third question goes to Suki Beavers from UNAIDS. And again, thank you so much for joining at the very early hour where you are. So I would like to know what governments can do to better support and protect the health and human rights of young sex workers who use drugs. Thank you.
Thanks very much. And let me start by congratulating YouthRISE on this important narrative research paper. And thanks, Ruby, for the excellent presentation. Just as Josephine and Marie did so effectively, I want to start by situating this question in the evidence and what we know from a global perspective. The incidence of HIV amongst people who use drugs is one of the key drivers of the epidemic and is leading to increases in new HIV infections in regions such as Eastern Europe and Central Asia, rather than moving us towards the decreases that we really want to see. In the global AIDS strategy, UNAIDS and all participants set out bold targets on societal enablers for the HIV response, acknowledging that it is often punitive laws and policies that are driving these figures amongst people who use drugs. The most recent available data from the Global AIDS Update shows that in only 54 out of 135 reporting countries are needle syringe programs operational. And in only 48 out of 134 countries was opioid agonist therapy available. So obviously we have a long way to go. Further, laws and policies such as age of consent and parental consent laws that have already been referred to this morning further restrict the ability of young people to access relevant services. 153 of 195 reporting countries criminalize sex work. In YouthRise's new report, you really clearly show that all of these factors come to a head when we consider the health of young sex workers who use drugs, and in particular, the risk of acquiring HIV. Young sex workers who use drugs face a triple burden. I think Josephine, you referred to a double burden, but it's perhaps a triple burden and more when we take into account stigma and discrimination faced by sex workers, by people who use drugs, and by young people, and then again also any of the other identity points that also result in stigma and discrimination. And UNAIDS recognizes the impact that the discrimination faced by each of these groups has on their risk of HIV acquisition. But it's important, as Marie said, that we use an intersectional feminist approach that captures the reality of people's lives. And as you've all said, a siloed approach is not going to work. And all three of you highlighted that this is because there are overlapping and intersecting identities that multiply people's risks of acquiring HIV. And in order to tackle these, we have to have, and governments have to take, a holistic and enabling human rights-based approach that includes providing comprehensive harm reduction services and decriminalizing both sex work and drug use. Your new report reinforces the need for all of us, including governments, to take this approach if we're going to end AIDS as a public health threat by 2030. I wanted to take just a moment here to mention the recent legal principles developed by the International Commission of Jurists in collaboration with some of the world's foremost human rights and criminal law experts. These principles that were launched just last week on International Women's Day address the use of criminal law in relation to drug use and HIV, and they make it clear that criminalization of drug use, of drug paraphernalia, or the provision of drug-related information is not consistent with international human rights obligations. It's crucial that we listen to all experts on this matter, not just criminal law experts, but also all of those who are experts by experience, which we can clearly see in the report by YouthRise, and that all three of you have reflected this morning. The intersecting inequalities and discrimination facing young sex workers who use drugs only serve to increase health disparities and lead to negative consequences. And we know that decriminalization and comprehensive harm reduction services work to reduce HIV rates among sex workers and people who use drugs. So all of this points to what is it governments need to do. We know what they need to do, and they know what they need to do too. And so let me take this opportunity to reiterate the call to governments set out in the Global AIDS Strategy to remove legal and policy barriers, including age of consent laws and policies to access HIV services and ensure access to other services related to young people's well-being. This new Youth Rise report demonstrates really clearly that the actions set out in the Global AIDS Strategy, and in particular, the importance of reaching the 10-10-10 targets, will be crucial for us to end AIDS by 2030. Thank you.
Thank you so much, Suki. Everything you've been able to bring to this discussion is very insightful. It's great to hear from the UNAIDS perspective and to learn about what you think governments should be doing to better support this key population and its intersecting identities. Thank you so much. I'm going to now turn the same question to Marie and Josephine. And to Josephine first. So what can governments do to better support and protect the health and human rights of young sex workers who use drugs?
Thank you, Ruby, for that very important question. And from a community perspective, I'd really talk on issues around decriminalization of drug use and sex work at the same time, and trying to see how also some of the policies that are affecting us, how really we could mitigate that as communities. But then I feel like also at a grassroots level, we have been able to, at a grassroots organization, organizing along with peer engagement, we've really been able to offer the peer support also at our levels. But then how far can this go when we still have the legal and the policy barriers that are actually limiting us to achieve our full potential? So I really feel the peer engagement has paved way for active participation of people who use drugs in harm reduction, both at the policy making level, at research level, just like the research finding that we're trying to disseminate here right now, at the programming level, and also at the advocacy and service provision level. So I really feel that governments should have a more inclusion approach and optimize community-led approaches to decision-making, and not necessarily sitting at these high-level meetings, making policies on our behalf and not necessarily knowing what is really going on. And then also as community, we run by the policy of nothing about us for us. So I really feel that we really need to be in these decision-making spaces. We really need to be at the table where these policies are passed, so that we can share the real-life experiences that we are actually having in the community. And then from that, probably would really have a good way forward. And then there's issues also around inequalities and access barriers and services. And really, we will not be able to achieve the SDG laws, the SDG goals, when we still have the legal barriers here with us. So also, I'd really like to call for the government to engage youth from a multitude of intersecting identities. Really, people who use drugs are, not really homogeneous, and there's all these diversities that really come with it, and no one is actually talking about it. No one is doing any advocacy about it. So I really feel like youth and young people should really be engaged with the intersecting identities, both in the implementation and evaluation of youth-friendly and youth-led services. Again, donors also need to really be cognizant of the intersecting issues. Like when we are bringing projects to these countries, we really need to figure out actually, is it something that would really impact the community positively? So I'm really calling for a meaningful community engagement, and also issues around person-centered care, especially for sex workers who use drugs. And sometimes we have these policies and these standard operating procedures in place that not necessarily address some of the overlapping issues and the unique key issues that young sex workers who use drugs face. So again, I would really like to call for a human-centered design approach, in the sense that, can we really have a human face also to the programs that we are doing, to the recommendations that we are doing? I know there's a a number of government delegates here and people who actually pass policy. And so can we meaningfully use this space with the communities in mind? And then the issues of lack of comprehensive harm reduction package that specifically address the unique health needs of young sex workers who use drugs. It's something that really needs to be talked through at length, and if we could really scale up and probably produce evidence and data that would really inform our programming. Thank you.
Fantastic. Thank you so much. It's really great to hear about the recommendations from the community level in regards to harm reduction services and a comprehensive package that not only tackles and serves the needs of young sex workers, but also young sex workers who use drugs and the other various identities that they have. So turning to you, Marie, to answer this question, this final question. What can governments do to better support and protect the health and human rights of young sex workers who use drugs?
So I found it a bit hard to prioritize here, but I'm going to start with one that I think in the German context, in a legalized context, quite important. In a place where regulations and laws are already in place to shape sex workers' lives, we need more research and we need more data, and we need young people with intersectional approaches to produce the data and analyze the data, and we need input from sex workers and drug users alike along the process. The laws that we have are being made whether the data is there or not, apparently. So it's all our responsibility to contribute to the data collection and inform policymakers. That's also a key finding of our paper, actually, that there's just an immense lack of data for this group of people in particular. This is why YouthRISE calls on official government and UN bodies to address discriminatory policies by making all efforts necessary to produce reliable research. In Germany, it's the Prostitution Protection Act. In other places, it might be other laws that call for review or reform. But in all cases, the voices of young sex workers who use drugs and sex worker-led organizations need to be amplified. We also call for compassion in dealing with vulnerable populations and the use of sensitive vocabulary. We furthermore call on governments to improve access to safety and health services and for less judgment in dealing with young people's reasons to either sell sex or use drugs. Harm reduction initiatives need to adapt to the needs of young sex workers who use drugs with harm reduction kits that are especially designed for this group of people. We need more age-specific support for sex workers who use drugs, more guidelines and information material just to get more knowledge out there. So obviously there's a lot of work to be done, as Josephine also showed already. But what I personally and what we at YouthRISE believe is that young sex workers have a huge potential to be catalysts of change. We already are. Don't get me wrong, but empowerment doesn't have to stop on a personal or a community level, but can be backed by state and legislation. Sex workers and drug users might be some of the most diverse global populations, and it's exactly in this diversity where the capability lies to bring super urgent topics like sex education, migrant, queer, and abortion rights to the wider society. Thank you.
Fantastic. Thank you so much for sharing your recommendations. And I really hope that the impact of this panel can start conversations amongst yourselves, amongst member states, and get, I think having an event like this on key populations and this particular key population that doesn't get spoken about enough. Hopefully people can actually start to think about what is needed and listen to young sex workers who use drugs and to entities like UNAIDS who are calling for the end to criminalization of people who use drugs. Great, well, that brings us to the end of my questions. We have 5 minutes left, so maybe we could take 1 or 2 questions from the crowd, and then maybe some final comments if anyone has any from the panel. Yes? Yes, please.
No, I was wondering, come from Italy, if you have some contacts with medical staff, because it's quite interesting that people, young people with maybe drug use disorders might require help. I saw in Germany some political parties asking for that in order to cope with the drug problem, because it's also a stigmatization that young people have these disorders, cannot get help because of the complex thing. And so I think it's quite good to consider that with the medical categories too, to get contact, and also with drug users organization like Represent.
I don't personally have any contacts with medical services in Italy. We don't actually have a member of Italy from our international working group. We do have a call out at the moment for people to join our international working group, which is how we inform the work we do at YouthRise. But I agree that they should also be part of the discussion. They're dealing with people firsthand and providing those services. I think it's really important that we also engage with these medical services and talk to them about how they can better provide services and approach young people who use drugs and young sex workers so that they really fulfill their needs. Yeah, thank you for that. Any other questions? Amin?
Thank you for your presentations. My question is for Suki Beavers. Why is there only few research about sub-communities in key populations? We hear very few times about young sex workers who use drugs, gay men who are already sex workers and use drugs. I mean, they are at a higher risk of having HIV, of facing stigma and discrimination, but still there's only few research about the sub-communities. Why is that? Thank you.
Thanks very much for the question. And I think the answer is exactly what this panel was talking about. And it's because of stigma and discrimination that there's so little research. And, if we go back to the old adage, what is counted counts, the invisibility is really part of the problem that we really need to dig into. And, that's one reason why this research is so important that YouthRise has presented today. We do need more evidence. We do need more data, and we need evidence of all sorts. We need quantitative, qualitative. We need community-led research for sure. So, I think you're pointing to a huge gap and something that really we need to turn our attention to and resource. And just on the resourcing front, that's the only other thing that I would add to the question that we all answered about what should governments do. Governments should also be funding community-led responses, including by young sex workers who use drugs. The 30, 80, 60 targets that are in the global strategy are all about ensuring that communities are leading, not just, being invited to participate in a passive way, but leading, and that requires adequate resourcing. So, the resourcing also is needed in order to carry out the research that you're referring to. So it's a bit of a cycle that we have to break. Thanks. Over.
Thank you so much, Suki. I really appreciate that answer, and thanks for the great questions. I'm going to stop the questions now and just quickly see if there was any last comments that any of the panelists wanted to make, and then we'll wrap it up because I think the next guys are coming in for the next side event session. Nothing? Okay. Amazing. Thank you so much, everyone who came today. I really appreciate your time and for learning about such an important topic. And I hope you can take something away from today. Definitely read our report, and we hope to engage with you further. Thank you.